Okay, so this is going to be the med demo for your PO med competency. When you get into this computer, this is the one that says MDU on it. This happens to be MDU number 3. So it's the one around the inside of the lab perimeter, not the one over in the patient room. You're going to click on the button that says Nursing Shortcut once you log in with your username. And you're going to go to Nursing 101 Practice and Comp Files. Then you're going to click on Practice. If you do happen to click on Comp by mistake, it is password protected. And then once you get into the practice, you're going to do PO Meds, MARS, and MDU. And you're going to pick whoever, or you would pick whoever you wanted to practice with if you were at the other cart. But because we're doing the MDU, we want to pick the PowerPoint presentation, which is at the bottom. It says Practice PO Meds and MDU. So it's the same place that you're going to do both things. Once you get into the PowerPoint, you're going to go into the slideshow mode. And then you're going to have this screen in front of you, and you're going to click on that to start. Whoever your person is that you're going to be practicing on is who you're going to select. You have Mary Gober, Marty Moffett, Kathy Devers, Tiger Bloom, and Charles Edwards, and I'm going to do Marty Moffett. So once I get in here, I have my keys to the med cart. I'm going to click, I'm going to look at the 6 o'clock meds. I'm going to do the 0600 medications for this demo. So I'm going to start at the top. And once I click it, it tells me what drawer to open. And I need to unlock my cart. Okay, once you hear the clunk, it's open and unlocked. So this is telling me drawer 1, but I can no longer see what I need out of there or the dose. So I'm going to hit the U-turn button and go back. And when I take out drawer 1, I have a couple different options in here. I have diphenhydramine, which is not what I want, and then I have digoxin. So I need 0.125 milligrams. I have 0.25, I have 0.125, so anytime that you have the ability to take exactly what you need, you're going to do that. So I have digoxin, 0.125 milligrams. It's not expired, the barcode is good, it's due at 6, so I'm going to put this in my cup. When you're pulling your medications, that's all you're doing is pulling. This part does not constitute a check because we don't have the MAR in front of us. So all we're doing is pulling the medications. Now I'm going to move on to the second one. And it's telling me it's coming from drawer 12. So I'm going to pull out drawer 12, hit the U-turn button and go back. And I need glyburide, so I have potassium back there and I have glyburide up here. Again, be sure to look and make sure that you have the right dose that you need. This says that I need 2 milligrams. It is due at 6. It's not expired. My barcode is good. The reason I want to make sure the barcode is good so it doesn't give me any issues when I'm trying to scan the med. And I'm going to put that in the cup. And move to the next one. The ketorolac is also due at 0600. I'm going to click on it. It's telling me drawer 7. Go back to my order, and that's vancomycin, and this is not the right one. Hang on. Oh, here we go. Okay, so be careful to look. All right, so this is ketorolac. It's 15 milligrams per ml. I'm going to need 30. I'm going to make sure that I don't have any other constitutions of that, and I don't. So I'm going to take this with me. I'm going to bring the whole bottle. I'm not going to inject or prepare any of that right now because I'm going to do that with my first check. All I'm doing is pulling the med. So I have that. And these also have barcodes, which you want to make sure aren't damaged, and it also has an expiration date on it. So then I'm going to go down to the pantoprazole, which is also due at 6, and get it out of drawer 6. Let's see. So I'm going to go back to my order, and I have pantoprazole, 40 milligrams. It's due at 6. The barcode is good. It's not expired. I'm going to put that in my cup. Next I have lorazepam, which is telling me is in the controlled substance drawer. So that is the drawer here on the top. I'm going to go back to my order and pull out my paper. I'm going to find my lorazepam 2 milligrams. Make sure you have the right medication when you're signing these out. Okay, so we have 2 milligram tablet. Now I'm going to find the 2 milligram tablets in the bag. The next thing I have to do is count my medications before I take what I need. So let's count everything in the bag. I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 14, 16, 18, 20. So when I go to sign this out, I just got 20, which should be the number to the left of where I'm getting ready to sign this out. When I sign out this med, I have to do the date, the patient name, who prescribed it, what the drug is, the dose, the time, and then my signature as the nurse. And so even when you're practicing, you're going to write in all of that information so that the count stays right. If you're practicing and you see that the count is off, please let somebody know so we can fix it. I'm going to take all the ones that I am not using, put them back in the bag. Once I have signed out my medication, taken what I need, and I'm going to put all of these back in here and lock it. Close the drawer. Then I have magnesium hydroxide. It's telling me that this is in the liquid meds drawer. So I'm going to pull this out. I'm going to go back to my order. And let's see. All right, magnesium hydroxide. And this is the regular strength. Okay. And so I'm just taking the bottle with me that I need. I'm not taking anything else. Be sure when you're looking at your bottles that whatever is supposed to be in there is in there. Make sure if it says extra strength, you grab extra strength. If it says regular, just grab that. And just going to do a quick look. So I should have 1, 2, 3, 4, 5, and then the lorazepam is PRN. So when you're practicing, you can expect to get a portable, an injectable, a controlled substance, and some PO medications. And so even though we're doing 6 o'clock meds, the lorazepam is PRN, so your comp card would probably tell you that this person is complaining of some anxiety and you're going to have to decide that you want to give that medication. So once I have everything that I need, I can hit the escape button and close out of here and sign off. going to bring one of these cups with me so I can measure when I get back to the room. I already have a med cup. I'm going to bring some alcohol preps and a syringe label to put on my syringe. And unlock this card. Okay, and I'm going to grab the syringe that I need with an extra needle so we can change the needle. Anything I'm taking out of the cart, I'm going to make sure I relock it when I get ready to go.
There are labels around the room for you to label your syringes. So what you can't see is a dispenser for the various types of stickers to label your medications.
So I have the one that says syringe medication. Now I'm going to take everything that I have and I'm going to travel to the patient room. Okay. Make sure I have a pair of gloves ready, and I need to grab an Injectipad. All right, I'm going to leave my Injectipad on the bed, sanitize my hands. And so at this point, I'm kind of outside the room. I'm not really in the room yet with the patient, but my computer is here at the bedside with my scanner. And I also have another spot here that says nursing shortcut. So I'm going to pull that open, go back into the Nursing 101 practice and comp folder, go to the practice folder, go to PO meds. And this time I'm not going to open the MDU. I'm going to open the actual MAR for the patient. So I have Marty Moffat. And I'm not going to do an update right now. And the first thing I'm going to do is read through the top. I have Marty Moffat, date of birth 7/5/1968, age 50, female, room 304A, 59 kilograms, was admitted someday at some time. Medical record 6083402. Diagnosis is a fractured left humerus. Allergies to meperidine, and doctor is John Matthews, and these have been verified by Lucy Thomas, RN. So that's the first thing I'm going to do. So I know that my meds have been verified, and I know what my patient's allergic to, so I can make sure I don't give them that. And then I'm actually going to be scanning over in this first column because 0600 still falls on the night shift time, so it's going to be this first block over here. And this is not in the same order that they were on the MDU, but I'm always going to go in order so that I don't skip or forget anything. So the first thing I have is magnesium hydroxide. And it's 1,200 milligrams per 15 mLs, and I need 30 mLs. So I have my cup here. I'm going to make sure that when I pour this, I'm on a level surface, not near the computer, so Katie doesn't kill us for spilling on the computer.
I would never do that.
Pouring away from the front and the back label. Make sure you can see.
Scoot your head to the right a little. There
Sorry.
you go.
This is not shaking very well. Make sure you shake everything up. These meds are not what they seem in here, so I have my 30. I have checked the barcode. It's not expired, and 30 milliliters is what I need, and it's due at 6. So I'm gonna move these over here. For my own visual purposes, when I pass meds, I know that if they're out of the cup, I need to do something with them. So that's kind of what I do, is pour them out of the cup. The next thing on here for 6 o'clock medications is the Ketorolac, and it says that I need 30 milligrams, and I have 15 milligrams per ml here, so I'm going to need 2 mLs. Barcode is good, it's not expired. So what I'm going to do is find my alcohol prep that I was certain that I grabbed but don't have. Okay. And I didn't leave the room, I just went to the door because you can never leave your medications. So I'm going to take this out. I'm going to scrub the top of the vial for 30 seconds. Once my 30 seconds is done, I'm going to open this up, remembering that it's sterile, so you want to be careful not to touch any of the connecting points. Pull back the amount of air that I need,
Which is how much?
2 milliliters, because I need 30 milligrams and I have 15 milligrams per ml. So I'm going to pull this back, inject my air, and draw up my tube, making sure that I get all my bubbles out. Make sure when you're drying up that you stay below the level of the solution so you don't get air. And then I'm going to scoop my cap back on. On my syringe, I'm going to put the patient's name, what the medication is, the amount, and the date that I prepared it. And I'm going to put it down here so I can still see how much I have in the syringe. If I put it on the cap has the potential to fall off. So I'm going to put it below where I drew up the medication.
Can you bring it closer to the camera so I can? Thank you.
Okay, so the 2 milligrams that I drew up is part of the first check because I have to make sure that I have the right amount. Check the barcode, it's not expired, it's 15 milligrams per ml, and I have 2 mLs, and my order says I need 30 milligrams. So this one now can go over here. The next medication is glyburide. Take out my glyburide. I have 2 milligrams. It's due at 0600. It's not expired. The barcode is intact. So I'm going to put that in my cup. Please remember, when you're practicing or comping, you're not actually going to open the medications. We'll go through the process of how that's going to work in your comp. The next medication that I have is the pantoprazole, 40 milligrams. And my order calls for 40 milligrams. It's due at 0600. It's not expired. The barcode is good. I'm going put that in my cup. And next I have digoxin, which my order says 0.125 milligrams, which is what I have. It's not expired. The barcode is intact. It's due at 0600. I'm going to put that in here. Now I go down here because my lorazepam was a PRN medication, and I decided that I needed to give that because my card said my patient was anxious. So in order to give a PRN medication, I have to make sure that I know if it was last given. And it can be given every 4 hours, and I can see the last 4 hours on this time slot. Nobody gave anything on the night shift, so that should mean that I'm good to give it. So I am going to put the time in here and check that I have 2 milligrams of lorazepam. It is not expired. They can have it now. It's 0600 and the barcode is intact. So right there is one check. First check takes the longest because it's when you do your prepping and your pouring of your medications. Now I'm basically going to start the process over with the second check. So starting from the top again, I have my magnesium hydroxide 1200 milligrams per 15 mLs. My order calls for 30. This is not expired. The barcode is good. And I have 30 milliliters in my cup. Next I have the ketorolac, which is 15 milligrams per ml. My order says I need 30. It is due at 0600. It's going to be given via IM injection, which is why I picked the needle size that I did, which is a 22 gauge 1.5 needle size. And because I only have 15 milligrams per ml, I have 2 mLs in here to equal my 30 for my order, and my syringe is labeled. I'm going to take these meds back out of the cup. I have my glyburide, 2 milligrams. It's due at 6. It's not expired. Barcode is intact. Put that back in here. Next is pantoprazole. I have 40 milligrams. My order is 40. It's due at 0600. Barcode is intact and it's not expired. Next I have my digoxin, 0.125 milligrams. It's due at 0600. It's not expired and the barcode is intact. And then I go back down to my PRN, lorazepam. I've decided that they can have it because they haven't been given it. And I have lorazepam, 2 milligrams. It's due at 6. And it's not expired. The barcode is intact. So I'm going to put that in there. So second check is done. Now we are actually heading into the room. So I'm going to sanitize my hands. Introduce myself to the patient. Good morning, Marty. My name's Kim. I'm going to give you your morning meds. First thing I'm going to do is go back to the top here so I can see this information. I'm going to put my cursor right in the gray box. Marty, can you tell me your name and date of birth? And she tells me Marty Moffett, 7/5/1968. So I'm going to take my scanner, actually check to make sure it says Marty Moffett, 7/5/1968. I'm going to scan the barcode, and I know that it's scanned because I heard the beep, and I have numbers in the gray box. I'm going to move to the next medication, which is the magnesium hydroxide, 1200 per 15 mLs. I have 30 milliliters, and okay, my med is not expired and the barcode is good. So I'm going to put the cursor there, scan the barcode, and to the next one. All right, I have ketorolac, 30 milligrams IM every 6 hours. Let's do it 0600. This is 15 milligrams per ml. I have 2 mLs. It's labeled, and there are 2 mLs. No bubbles. And I'm going to maybe scan the barcode. Okay. Next, my medications are coming out of the package, or out of the cup again. So I have glyburide, 2 milligrams, do it 6, it's not expired, barcode is intact. I'm going to scan it, and it's not scanning. So if this happens in your comp, we will help you. We'll pretend it beeped, and you'll get some numbers in the box. So we'll pretend that that beeped, put it in the cup. Next we have the pantoprazole, 40, let's do it 6. It is not expired, barcode is intact. Okay, that one worked. So we'll put that in here. Next we have digoxin, 0.125 milligrams PO. Let's do it 0600. And it's not expired. My barcode is good. And this one's not going to scan either. So we'll say it beeped. And put some numbers in the box. So normally in real life, if you have a medication that doesn't scan, you should let the pharmacy know, because it's not good to do any overrides on meds. For purposes of time for this comp, we won't make you do that. We'll help you through it. But just so you know, it's not a good practice to get into not scanning your meds. These meds in this lab are very well loved and well used, so that's probably why it's not scanning. Next I have my lorazepam, 2 milligrams PO. It's due at 0600. They have not had a dose in the last 4 hours. It's not expired, and the barcode is good. So, okay. And we'll pretend that one beeped. Alright. So I have now scanned all my medications. Notice that I have not opened my medications at this point. Even if it were real life, I wouldn't open my medications yet, because what I want to do is explain to my patient what I'm giving them. And so however you do this in your comp is fine. You have to tell them that you're giving them milk of magnesia or magnesium hydroxide, whichever they know it by, and you can hand this over. Once you hand these to your instructor, it's as if the patient has taken the medication, so any pre-assessment things that need to be done have to be done before you give the med to your instructor. So for this particular medication, you probably just want to make sure that they're not going to the bathroom or having diarrhea. Otherwise, no implications with that. For the ketorolac, what I would want to do is see what their pain level is. Again, I already checked and read the top to make sure that they don't have any allergies to this medication. And just for the purposes of time, I'm going to save my injection for last. Then I'm going to go to the meds. You can pick whatever. You can give your instructor one at a time. You can do the whole cup at one time, but you just have to make sure you have done everything you need to before you give it. So I would tell the patient that I have their diabetic medication. You can bring cards with you that have the class and things that you need to do. You don't need to commit it to memory. Just make sure whatever you're using that you are used to using it. If you have a med book that's tabbed, make sure you're used to looking in it so that you don't fumble around looking through the pages and eating up your comp time, because you have 30 minutes to do this comp. So let's see, I have my glyburide, so I would want to know a BG before giving this. We will talk to you in your collaborative groups about everything you need to know before giving all the medications. So I can either give it to my instructor now or put it in the cup and do them all at once. Next I have pantoprazole for acid reflux, and not really much I need to do before giving this particular medication, so I can put that in there. I have their digoxin for them, and digoxin is an antiarrhythmic, so I do have to know that I'm going to check the apical pulse for a full minute, have my stethoscope with me, and you're going to demonstrate the placement of your stethoscope on the mannequin at the left mid-clavicular 5th intercostal space, and you have to know the landmarks. And if you have a dig level that's available, you can mention that as well, but you're not going to have that for every patient. So I'm going to put that in there. When I'm recording blood pressures, pulses, and things like that, I can go back up to the box and type them in. So if my instructor tells me that this person's apical pulse is 75, I can put that in there. We would not give digoxin if the apical pulse was less than 60, but it's likely that that won't happen for your comp. For the lorazepam, I need to make sure I have the patient's respirations. It's for their anxiety, and we also have to drill safety for this. So the side rails have to be up. We have to tell the patient not to get up without help. Make sure the call bell is in reach, and make sure that they understand that they can't get up alone. So once I've done that, I can give my pills to my instructor. I'm going to type my respiratory rate in here. And then I am going to do my injection last. I have my Injectipad over here. You will be given a site on your card, so you will have to demonstrate where the landmarks are, know the actual landmark names, and make sure you tell all that to your instructor. Make sure that you have gloves to give your injection. And the last thing I'm going to do before I give this, which I probably should have done before now, but we're improvising, is I'm going to change the needle, drawing back air to get all the solution out. Getting rid of that, putting on my fresh needle because I don't want to poke a patient with a needle that's been through a rubber stopper. And I'm going to move it back up to my 2, and I now have a new needle for my patient. Got my alcohol prep, I have my gloves on. Bed should be a little higher for me, but it's down at the foot. Use good body mechanics. So you'll have already demonstrated where your injection's going to be and said the landmarks. You're going to be using the Z-Track method. Sorry, my glasses keep falling down. You're never injecting liquid into the Injectipad, so your instructor will hand you a syringe that is empty so you don't ruin the Injectipads. You're never recapping the needle. You're always scooping when you draw up. So, taking my cap off, I am...
Do you want to bring it over here?
Just show. Here. So I'm going to Z-Track by displacing, and I'm going to dart, stabilize, aspirate, inject, and then when you let go of the tissue is when it would go back over. So less irritation. I'm going to flip the cap up, put it right in the sharps container. You can't recap or else that's an automatic fail. I'm going to take my gloves off. Get rid of them. Wash my hands. Ask my patient if there's anything else that they need. And you are going to have to, at this point, write a note in the PRN section. You're going to have to write that you gave lorazepam for patient complaints of anxiety. You're going to put the time 0600, and then you're going to go back and write at 6:30 that you reevaluated and the patient verbalized that they were comfortable or that they were sleeping. And then once you're done, you're going to check the box down here at the bottom and make sure all of your pre-assessment stuff was documented.
Can you show me the box you checked again?
Yep, down here at the bottom, right here.
Thank you.
Once I do that, it means everything that I need to do is done. I've already drilled safety with my patients, the side rails up, so we will cover them back up, leave them in good condition, and sanitize and leave the room. When you're done practicing or with your comp, liquid medications have numbers on them that show which MDU they came out of. They go back to the same spot. And the injectables and all of your PO meds will go in the pink buckets, which maybe we can show you, that are placed around the lab. So you're going to put those in there. You're not going to return them to the drawer. And then once you've done all that, poured your liquid back in, put your bottle away, and cleaned up your mess, you are done.
And make sure you log off your computer. And again, double check to make sure all of your carts are locked.
And make sure when you're logging off, you hit don't save so that it leaves the MAR clean for the next person who's doing the comp. And then you sign out and you're good. That's it.
Thank you, Kim.